There are five terms which are very much associated with blood gas interpretation. They are acidosis, alkalosis, metabolic, respiratory, and compensation, partial or full. I will try to make you understand and relate with what these terms actually mean with respect to our client's blood gas report during the course of this video. Now, this is a standard blood gas report that almost every one of you might have seen, and the four most important headers that you should be looking for are pH, PCO2, PO2 and bicarbonate. Coming to pH. pH is a measure of acidity or alkalinity of the sample. It is an acronym for power of H+, where H+ is the basic acidic ion. The normal value of pH is 7.35 to 7.45. Any value below 7.35 is considered acidic, and any value above 7.45 is considered alkaline. Coming to PO2, it is a measure of the dissolved oxygen in the blood. Normal range is 95 to 100. Now, the value of PO2 is not necessary for interpreting the acid-base balance. But this particular component of the report helps the professional to understand whether oxygenation of the client is adequate or not. This is because the levels of oxygen and carbon dioxide in the blood is under the control of the lungs. Coming to PCO2, PCO2 is a measure of the dissolved carbon dioxide in the blood. Normal range is 35 to 45. Now what I want you to remember is that anything to do with PCO2 is acid. It doesn't mean that carbon dioxide is an acid. It's basically a gas. But when carbon dioxide dissolves in water, it forms carbonic acid, which is an acid. In short, the more carbon dioxide in blood, the higher the acid levels are. Values above 45 is considered acidic and values below 35 is considered alkaline. Coming to bicarbonate or HCO3, this is a measure of the bicarbonate level of the blood. Normal ranges are 22 to 26. We must understand that it is both the kidneys as well as the lungs which work hand in hand to maintain a normal pH of 7.35 to 7.45. To learn basic blood gas interpretation, we need to look at pH and bicarbonate levels only as of now. One basic concept we need to understand is rule of Bees. According to the rule of Bees, if pH and bicarbonate are moving in the same direction, that is, if pH and bicarbonate are high or low, then the cause for the acid-base imbalance is metabolic, and similarly, if pH and bicarbonate are moving in opposite directions. The cause for the acid-base imbalance is respiratory. You need to somehow by heart this, as this particular rule of B will help you interpret it, whether the cause is respiratory or metabolic. Mnemonic to remembering this is sane. SA from sane and MA from metabolic. Let's interpret a few scenarios here. A pH of 7.26 and a bicarbonate of 20. Now if you see, the pH is less than 7.35, hence acidic, and applying the rule of B, you can see both the pH and bicarbonate are low and in the same direction, hence metabolic in cause. So the final interpretation would be metabolic acidosis. A pH of 7.50 with a bicarbonate of 30, pH is elevated, hence alkaline. Both the bicarbonate is also elevated. Applying the rule of P's, both pH and bicarbonate are high, that is in the same direction, hence metabolic in cause. The final interpretation is metabolic alkalosis. pH of 7.21 and a bicarbonate of 38. pH is low, bicarbonate is high. Applying the rule of B's, you can see pH and bicarbonate are in different directions, hence respiratory in cause. The final interpretation, respiratory acidosis. pH of 7.50 and a bicarbonate of 26. pH is high, hence alkaline. Bicarbonate is normal, but it could also be called a high normal because it is towards the high end of the normal range. And since pH and bicarb are in the same direction, the cause is metabolic, and hence the final interpretation is metabolic normal alkalosis. Let us now look into the signs and symptoms of alkalosis and acidosis. Raised pH of alkalosis is associated with hyperreflexia, irritability, tachypnea, tachycardia, borborygmy, seizures, and hypokalemia. And low pH or acidosis is associated with headache, hyperreflexia, bradypnea, bradycardia, or heart block, paralytic ileus, coma, respiratory arrest, Kussmaul's breathing, and hyperkalemia. Now if you look carefully, as the pH goes, the various systems in the body gets excited, and similarly as the pH goes low, various systems goes depressed. Only potassium shows an inverse relation here. Hence the statement, as the pH goes, so does my patient, except for potassium. Please remember this. Alkalosis is associated with hypokalemia and acidosis is associated with hyperkalemia. Whenever a nurse sees a seizure, the first important step that should come to the nurse's thought process is suction. Similarly, if you see or hear respiratory arrest, the first thing that should come to your mind is amber bag. Now, Kussmaul's breathing occurs only in metabolic acidosis. Mnemonic to remember that is Kussmac. Let's try to understand the causes of acid-base imbalance. Whenever you get a scenario to work out a blood gas report, go through the scenario and ask yourself, is this a lung scenario? If it is yes, most probably causes respiratory, and if it is no, it will be metabolic. We'll try to understand the respiratory causes for acid-base imbalance. Two most important physiological reasons are overventilation and underventilation. Overventilation causes a rapid decline of PCO2 as more carbon dioxide gets flushed through the alveoli. We have learned before that PCO2 should be equated with acid levels. So as the PCO2 drops, the acid level also drops. This results in alkalosis, and since this is of respiratory origin, this results in a respiratory alkalosis. Two scenarios where this is commonly seen is one in pregnant women who hyperventilate due to the enlarged uterus pushing upon the diaphragm, and in ventilated patients whose ventilator settings are set on too high. Let's see what happens in underventilation. Due to carbon dioxide accumulation in underventilation, the PCO2 levels, they go high. So hence the acid levels also goes high, resulting in acidosis. And since this is of respiratory origin, causes respiratory acidosis. It is seen in emphysematous patients, drowning, pneumonia, and ventilated patients whose ventilator settings are set too low. It can also be seen in patient-controlled analgesia pump toxicity. Coming to metabolic causes, it is broadly classified as 1. Due to prolonged suctioning or vomiting. 2. Anything else. Prolonged suctioning or vomiting results in metabolic acidosis. This is because the gastric juices contain lots of bicarbonate, and when there is a prolonged suctioning and vomiting, these bicarbonates are lost, resulting in the blood becoming acidic. The causes are surgery with nasogastric tube suction for 3 days or more, and hyperemesis gravidarum. The other cause, anything else, basically refers to any disease process that causes retention of bicarbonate in the system, which leads to metabolic alkalosis. Examples include acute renal failure, infantile diarrhea, third-degree burns over 60% of the body, and hyperemesis gravidarum with dehydration. Now, I would like you to bring your attention to this highlighted area. I'm highlighting with dehydration because I want you to note that hyperemesis gravidum can cause both metabolic acidosis as well as alkalosis. It is when it is associated with dehydration that it causes metabolic alkalosis. Remember this. Hyperemesis gravidarum with dehydration causes metabolic alkalosis, and when hyperemesis gravidarum is not associated with dehydration, it causes metabolic acidosis. And this is one thing you should always pay attention to. If your question has a modifying phrase, like for instance, in this case, with dehydration, pay attention to that than the original statement. This modifying phrase might be the clue to your answer. This brings us to the last topic, compensation. Whenever the acid-base balance is changed, the body tries to set it right. This process is known as compensation. In short, compensation is the body's response to respiratory or metabolic alkalosis or acidosis. Now let's try to understand what the body does when acid-base imbalance happens. The body compensates for the respiratory origin imbalances by adjusting the bicarbonate levels. In case of respiratory alkalosis, body tries to reduce the bicarbonate levels by excreting it through the kidneys. And in case of respiratory acidosis, it tries to raise the bicarbonate levels. The mnemonic to remember this is RABI. R for respiratory, B for bicarbonate. Similarly, the body compensates for metabolic origin imbalances by adjusting the PCO2 levels. In case of metabolic alkalosis, the body tries to increase PCO2 levels by reducing the respiratory rate. And in case of metabolic acidosis, it tries to decrease the PCO2 levels by increasing the respiratory rate. The mnemonic to remember this is mechanic. M for metabolic, C for carbon dioxide. This is the compensatory mechanisms that happens during the various imbalances. Respiratory acidosis gets corrected with a metabolic alkalosis. Metabolic acidosis is corrected with a respiratory alkalosis. Respiratory alkalosis is corrected with a metabolic acidosis, and metabolic alkalosis is corrected with a respiratory acidosis. Let's try to understand this in detail with a few scenarios. pH of 7.30, bicarbonate of 49, and PCO2 of 50. pH is low, bicarbonate is high, and PCO2 is also high. Applying the rule of B here, pH and bicarbonate are in opposite directions. Hence, the cause for imbalance is respiratory. pH is low and hence acidosis. Let's look at the compensation part. Applying the mnemonic here for respiratory, it is RABI. We need to look only at the bicarbonate. Since the bicarbonate is going high, we can tell that it is compensated. And to say whether it is compensated fully or partially, let's look at the pH. pH is still not in the normal ranges, so the compensation is only partial. Another scenario, pH of 7.50, a bicarbonate of 41, and PCO2 of 51. pH is raised, bicarbonate is raised, and PCO2 is also raised. Applying the rule of B here, pH and bicarbonate are in the same direction, hence metabolic. pH is on the higher side, alkalosis, and applying the mnemonic for compensation. Since this is metabolic, mnemonic is MECA. Let's look at the carbon dioxide levels. It is on the higher side, so it is compensated. To say whether it is partially or fully compensated, we look at the pH levels. pH is still not in the normal ranges, so we can say that compensation is partial. Another scenario, pH is 7.35 with bicarbonate 30 and PCO2 49. You can see here that the pH is normal, bicarbonate is raised, and the PCO2 is also raised. Whenever we get such questions where pH is normal and bicarbonate and PCO2 levels are abnormal, we should apply another logic called the alkalotic and acidotic normal for interpreting. As we have learned before, the normal pH is between 7.35 to 7.45. But if we further expand this range on a scale, we can see that the median or the average is 7.40. So according to this logic of acidotic or alkalotic normal, the values that lie to the left of 7.40 are considered more acidic or acidotic normal, and those lying to the right of 7.40 are alkalotic normal or more alkaline normal. Coming back to our earlier scenario, let's apply the rule of B and the alkalotic or acidotic normal logic to it. pH is normal but is acidotic normal. Bicarbonate is 30, which is high. PCO2 is 49, which is also high. Applying the rule of B here, since pH and bicarbonate are in opposite directions, it is respiratory in cause with a normal acidosis. Now let's look at the compensation. Being a respiratory imbalance, the mnemonic that we should be applying is Rabai. Looking at the bicarbonate levels, it is elevated, indicating a compensation, and since the pH is in the normal range, we can call it fully compensated. Let's look at one more scenario. A pH of 7.44 with bicarbonate 35 and PCO2 48. In this scenario, applying the acidotic alkalotic logic, pH is normal alkalotic, bicarbonate is high, PCO2 is high. Applying the rule of B, since pH and bicarbonate are in the same direction, the cause is metabolic, and since pH is normal alkalosis, the interpretation is metabolic normal alkalosis. Let's look for compensation here. Since this is a metabolic cause, applying the mnemonic for metabolic, which is meca, we will look for PCO2 levels. PCO2 is high, indicating compensation. The pH is in normal range, which tells us that it is fully compensated. Cornock et al. In 1996 in a study concluded that in order for the sample to be accurate, it should be analyzed within 10 minutes of sampling